Welcome to the Evanston Woman Today show. I'm your host, LDB. Dry eye syndrome has been affecting women more and more each day. And Dr. Deana LaBrosse here at the Evanston Eye Wellness has welcomed us in to learn a little bit more about what she specializes in. Thank you.
I'm glad to have you here.
Yes, so tell me a little bit more about the dry eye syndrome.
Dry eye is such a ubiquitous condition. There are so many people affected and they may not identify it as dry eye issues.
Sure.
My motto is you want to look great, see great, feel great, because those are the sorts of things that start to go out of whack when you have dry eye issues. So it could be you're not seeing clearly at the end of the day on your computer screen. It could be you're waking up with red eyes. It could be physical discomfort. It kind of all fits into the spectrum of dry eye issues.
Is there like an age range where people see a difference in their vision with dry eye?
We used to say this was an aging condition and a female condition, and all of that's gone out the window with our computers.
Yes.
Personal family experience. I've got younger sisters who grew up using computers, and they have lost a lot of their meibomian glands, one of the main producers of tear film, because they're not blinking. So there's a lot of visual hygiene that goes into how well your eye can get itself.
Okay, so when someone calls you and lets you know they set an appointment, what state-of-the-art equipment do you have here that helps you specialize and detect for treat and preventive health?
One of the main ways I do so is imaging. So I've got a special camera with some infrared optics that helps me actually image those glands that are inside of your eyelid.
Sure.
It helps me look at how they're functioning. I can look at how intact the tear film is between your blinks. I use vital dyes to determine how the tears are coating the surface, are there damage to the cells. So it takes about a half hour to go through all these different tests to determine where the root cause is.
But how important it is. Most doctors, I understand, just prescribe over-the-counter fake tears.
Right, and they're rarely helpful. There's too many options, and they all have different chemical compositions, and sometimes preservatives, which are actually counteracting the good that you're doing by putting moisture on your eye. So I am the first to offer artificial tears as a solution, but it has to be the right artificial tear, and it has to be replacing what your tears are lacking. Otherwise, it will do you no good.
So why do you do what you do every day?
Well, I am a dry eye patient myself. Long-time sufferer. In optometry school it started probably because of the studying and the computer use. And I've just been through the ringer myself and observing certain conditions in my patients that our normal treatments have not been helpful for. For instance, restasis.
Okay.
Or Zidra now. Jennifer Aniston is promoting Zidra.
Yes.
They have a role in treatment, but there's a very small percentage of the population that they help. And what I find is there's some basic eyelid hygiene, looking at your nutrition, looking at your systemic health, your lifestyle, goes a lot farther in treating the condition. So that's part of the reason why I opened this office, is I have a little more autonomy in offering those kinds of treatments to my patients.
Well, thank you. I appreciate it, because it's definitely well needed.
I believe so too. Yeah.
So you're having an event April 19th. Tell me a little bit more about the event.
Well, April is Women's Health Month and also Dry Eye Awareness Month. So I thought that would be a great way to kind of highlight what I do differently here, invite people who may have questions into the practice. We'll have a lot of different activities planned, such as a mini dry eye screening so they can actually see their tear film and what it's doing. We'll have some natural Arbonne products here, doing mini facials, bringing in the nutrition component with some healthy snacks and some nutrition-related information. So kind of an open house with some activities just to open our eyes to dry eye issues.
So it's April 19th from what hours to what hours?
5:30 to 8.
5:30 to 8, and you're located at 716 Main Street, right off the main Dempster Mile. If you have any questions about dry eye syndrome, please call Dr. LaBrosse. What is the phone number they can reach you at?
847-859-6877.
That's also in the bottom of the screen, as well as the website. Thank you again for inviting us in. Yes. For more information, please visit evanstonwoman.com.